Uh, this is a big topic, but I will try to cover it as quickly as possible, and as to make it more easier for you people to understand, I will try to share this presentation as well. So we have to make a diagnosis, mild or marked intellectual disability, other related mental, physical, and health related problems, treat or manage through them. What exactly we have to tell to the parents, what is required to make sure that these patients are helped properly, what medications can be used, and when should we refer this type of patients to specialist, right? So this is an important factor. Why do we need to know? One, intellectual disabilities are very common. Two, they are preventable, pose a huge burden, lead to some stigmatization. Risk to children with IDs is harmful forms of traditional healing, neglect or harsh treatment. हायर केयर गिवर्स स्ट्रेसेस, जिन माओं के बच्चों में इंटेलेक्चुअल डिसेबिलिटी होती है आमतौर पे उनमें बेशुमार साइकियाट्रिक मॉर्बिडिटी होती है. और एक easy way to treat these people is to involve the community, involve the people around you, and then you can help those parents and the children much more than what you feel you can do. So that is the good part of the situation. WHO definition, a condition of arrested or incomplete development of the mind, which is especially characterized by impairment of skills manifested during the developmental period, which contribute to the overall level of intelligence, that is cognitive, language, motor, or social abilities. This is a very precise definition of intellectual disability. Anything which makes our mind or brain grow less than the range which normal is, it is in the normal range, then it leads to certain complications. So the connectivity of the synapses won't be like that. The neurotransmitters won't be like that. There will be problem associated in other areas. So the understanding of the person, processing of the information, and everything is compromised. Core symptoms, low level of intellectual functioning and impaired adaptive behavior. Now, this is the term that we used in child psychiatry a lot, related to patients with intellectual disability. Impaired adaptive behavior. And this is important for you. So learn this term very well. Adaptive behavior. Adaptive behavior is that whatever the situation you are living in, you have to respond to the situation in an appropriate way. If you are not able to respond in the normal way, the way you are expected, then there is something wrong. So impaired adaptive behavior is the key. Mild intellectual disability, 50 to 69, moderate 35 to 49, severe 20 to 34, profound 0 to 20. इस फिगर में थोड़ा सा up and down है. Some people say mild is 51 to 70, which is probably the same. Moderate is 30 to 50 and 20 to 40 and then 0 to 20. Whatever the book you are following, overall, this is the rough estimate. So less than 70 is intellectual disability and more than 70 is considered to be normal. But more than 70 can have severe consequences as far as the psychiatric morbidity is concerned or adaptive behavior is concerned, because the intellectual disabilities are not just one parameter. They're a component of multiple parameters. जैसे अब आप वेज टेस्ट अप्लाई करते हैं तो उसमें कुछ वर्बल स्किल्स हैं, कुछ परफॉर्मेंस स्किल्स हैं और कुछ बाकी और पैरामीटर्स भी हैं. सो एक चीज नहीं है. देयर इज अ पॉसिबिलिटी कि अ पर्सन इज हैविंग अ स्कोर ऑफ से 100 on verbal cues, but the performance cues comes down to probably 50. So overall, the rate may be 70 or 69. So he will fall into moderate or mild form of intellectual disability. But देखने वाले को ये नहीं लगेगा, बोलता ठीक है, बातचीत ठीक करता है, चलता फिरता ठीक है, खाना पीना ठीक है, उठना बैठना ठीक है, लेकिन there is some problem with impaired adaptive behavior, which will only be highlighted when we will assess the individual in detail in a very specific way where it is required. Borderline intellectual disability pose more problems because these people are actually normal looking individuals. They educate up to matric or intermediate or graduation as well sometimes in certain situations, but their performance when they start living all by themselves is compromised. So a score derived from several tests like WISC, Stanford Binet, Kaufman, Ravens, etc. is dependent in the diagnosis of intellectual disability. Many types are available. So there are general and specific. Mean score is considered to be 100. And one standard deviation is 15 points, two standard deviation, 95% of population. So जब भी हम IQ लेते हैं तो हम 100 जो assess कर रहे हैं वो Bell के central point है. 68.8% of the people they have normal IQs. One standard deviation means around 70. That is fine. But when it goes to two standard deviation, then the abnormality with intellectual disability is too complicated and it gives rise to a problem. So anything ranging between 70 and 130 is considered to be fine, normal. Anything above 130 and less than 70 is considered to be a problem. Or this varies, as I said to you, depending upon what actually we want to, oops, sorry, it disappeared. Okay, I have to go back again to download it. Just मुझे आप एक मिनट दें. In the meantime, if you have any questions, you can go ahead with it. Any questions so far? Anybody?
No, sir.
No questions. अच्छा, अभी presentation शुरू हुई थी, मैंने वो actually बंद करना पड़ा मुझे, so for which I'm sorry because this was on my another hard drive which needs to be connected and then I had to use it. So just give me one moment. Okay. आज कितने लोग हैं?
सर 8.
सॉरी, आवाज मिस हो गई.
आज सर 8. आज एक्चुअली जरा पहले मुझे नहीं पता था ना, इसलिए.
हाँ, इसलिए क्या?
सर वो फिर मैंने अभी बस बताया, जब आपने मुझे बताया ना, मैंने अभी ही लिंक भेजा है सबको.
अच्छा, तो अभी लोगों को नहीं पता?
सर सबको बुलाया था, लेकिन अभी जब देखेंगे तो ऑनलाइन को आएंगे तो ज्वाइन करेंगे. जैसा पहले आप एक दिन पहले भेज देते ना, तो सब देख लेते हैं. अभी जैसे ऑनलाइन आएंगे तो फिर वो देखेंगे.
गलती थोड़ी सी मेरी भी है कि मैंने थोड़ा देर गई, लेकिन अनफॉर्चुनेटली लो इसको हम यहाँ पे रखते हैं तो ये ओपन हो जाएगा. I was slow actually in communicating.
That's understandable, sir. समझ सकते हैं.
Can you see the slides?
We can see you, sir.
मैं नजर आ रहा हूँ?
Yes, sir.
Good. शुक्र. Okay. Let's continue with this. So, मैंने ये करवा दिया था. Okay. Now, okay. So, adult attainment of subtypes. So, when we say intellectual disability means compromise in IQ, mild is 50 to 70, as I mentioned to you earlier. Adult attainment. So these children who have mild intellectual disability are literate, They have all the skills possibly with them, so they can clean themselves, eat themselves, cook themselves. They have a good speech, but when they are put into some kind of a special situation, like if they are put in a computer sciences course or a professional course, that is the point when, unfortunately, these people do have problems. And when they have problems related to this, then people start thinking that there is something wrong with this individual. But they unfortunately still don't come to psychiatrists for any help, which is a tricky situation. Psychiatric morbidity is very high in this group. And usually, and most of the time, these individuals come to you, you will assess them, and you will diagnose depression, anxiety, psychosis, and all that stuff, but you will not focus on intellectual capabilities or intellectual disabilities, which is unfortunately a problem in Pakistan. So हम apparently ऐसे adults को या बच्चों को देखते हैं, उनमें साइकाइट्रिक मॉर्बिडिटी भी देखते हैं, लेकिन हम ये असेस नहीं कर पा रहे हैं ना, पढ़ाई में ठीक है, इसने 10वीं पास कर लिया है, IQ में कोई प्रॉब्लम नहीं है, which is not actually true. There is a problem in IQ because the individual is independent, learns to is graduate, never means that his IQ is normal. So be careful about these individuals. In moderate intellectual disability, the literacy is plus minus. So he will not go at certain points. So maybe metric का इम्तिहान पास ना करे और मे बी किसी और एसोसिएशन में भर्ती भी हो जाए, लाइक सरकारी नौकरी भी कर रहा हो, और आई एम सॉरी टू से, आई शुड नॉट से दिस, बट पुलिस में भर्ती हो गया और कांस्टेबल लग गया, ठीक है, सो इतनी हद तक मॉडरेट वाले भी चल जाते हैं. सेल्फ हेल्प स्किल्स आर फाइन, डोमेस्टिक स्पीच इज फाइन, अनस्किल्ड वर्क विद और विदाउट सुपरविजन इज फाइन. सो एक पुलिस वाला जो ट्रैफिक को जिसने कंट्रोल करना है, उसको जब इतना सिखा दिया जाता है बार बार, तो वो उतना काम कर लेता है. सो अगेन, दिस नेवर मीन्स दैट दे आर नॉट हैविंग इंटेलेक्चुअल डिसेबिलिटी एंड कॉन्सिक्वेंसेस रिलेटेड टू इट. So we have to broaden ourselves as a psychiatrist. When we see them, we don't have to focus only on primary psychiatric morbidity, but also consider learning or intellectual disabilities. Sphere forms. Now, these are the individuals which are apparently visible to us that they are having learning disability, but the possibility of having severe intellectual disability in general population is beyond 2 standard deviation, which is less than 1 to 2%, which is again evident to everyone. So this is not only this individual that we need to address. We have to address all the groups in intellectual disability situation. And less than 20, of course, it is quite visible. They have a speech problem, they have perception problem, cognition problem, concentration problem, behavior, memory, emotions, movements, all these situations exist. Now the prevalence, as I said to you earlier, prevalence is 1 to 3. Sorry.
We can't see this. हमें presentation नजर नहीं आ रही.
नहीं आ
या
रही.
मुझे नहीं आ रही.
Let me share the screen again. Okay. Sorry. अब आ रही है?
अब आ रही है, अब आ रही है.
Good. Sorry. पहले बोलना था ना.
मैंने लिखा तो फिर interrupt नहीं करना चाह रही थी.
No problem. कोई बात नहीं. Coming back, prevalence. As I said to you, prevalence is 1 to 3%. And males suffer more than the females. Now, why is it so? इसके पीछे एक बहुत लंबी कहानी है, दुख भरी शायद कहानी है, कि मेल्स ही क्यों इफेक्ट होते हैं, फीमेल्स क्यों कम इफेक्ट होती हैं. इसको किसी वक्त फारिग वक्त में डिस्कस करेंगे, बैठ के बात करेंगे. लो एंड मिडिल इनकम कंट्रीज में प्रोपोर्शन जो है वो रिलेटिवली डिफरेंट है, ज्यादा है, और डेवलप्ड कंट्रीज में जो है वो थोड़ी सी एपिडेमियोलॉजी डिफरेंट है. Why that is so? Again, in developed countries, the possibility of childbirth, complications associated with it, pregnancy, vaccination, all those things are better. So again, it's a different topic, a bigger topic. We may touch this in few slides, but may not. So moderate intellectual disability out of this 1% is 10%, severe is 4%, and profound is 1%. And 85% are mild. 85% are mild. Now, this 85% of mild intellectual disability with 1% of general population means 1 करोड़ में से 1 लाख बंदा माइल्ड इंटेलेक्चुअली डिसेबल्ड है. सो पाकिस्तान की आबादी के 24 करोड़ में से 24 लाख लोग माइल्ड इंटेलेक्चुअल डिसेबल्ड हैं. मॉडरेट 10%, सीवियर 4% एंड प्रोफाउंड 1%. मैंने कहा 1% तो हमें नजर आ जाता है, लेकिन बाकी परसेंटेज हम भूल जाते हैं. Mild, usually no specific cause in 40% of the cases. In 40% of the cases, there is no cause, but genetic causes, injuries, infections, malnutrition, mothers suffering from viral infections during pregnancy, childbirth, trauma, etc. There are so many etiological factors. So when you start writing, the exam में सवाल आ जाता है, what is the etiology of intellectual disability or etiology of mental retardation? Then you have to start from social situation, poor socioeconomic status, then malnutrition of the mother, then pre-conception problems, during conception the problems, after conception the problems, and delivery the problems, and related to child. So there are multiple factors. Marked intellectual disability, the specific cause found more often is 1. Trisomy 21, then Fragile X, single gene disorders. Unfortunately, in Pakistan, still at some level, we are getting the genetic studies, as we have the access to it here. Here, the test is free. So I just have to write for Fragile X and microarray for genetics. The blood report goes to specific place where they assess and gave me the report that this person is suffering from Fragile X, this person is suffering from trisomy 21 or any other disorder. In Pakistan, this is not possible for me. So this is another factor where unfortunately we miss the diagnosis and we don't see them clinically. Prenatal factors, fetal alcohol syndrome. Now, of course, maybe in Pakistan, the mothers don't take alcohol during pregnancy, but it's not uncommon to have it in certain classes of people in Pakistan as well. So we have to be careful. Maternal infections like HIV and other viral infections. अब आजकल ये कोविड है, जिन माओं को कोविड हुआ होगा और वो प्रेग्नेंट होंगी और उनके बच्चे होंगे, वो कैसे होंगे ये आने वाले वक्तों में रिसर्च साबित करेगी. So we won't be able to assess them at this point in time. Perinatal, placental dysfunction, birth trauma, septicemia, jaundice, and postnatal birth infection and head injury. And I have mentioned some of the causes. So what is further etiology? Fragile X syndrome is the most frequent X-linked syndrome. One is to 2000 to 5000. So हर 2000 बच्चे में से एक बच्चा फ्रेजाइल एक्स सिंड्रोम है और हम देखते हैं नहीं देखते, unfortunately. Metabolic causes are 3% unknown causes. Fragile X is 1%. Subtelomeric is 6%. Chromosomal is 12%. Environmental 25%. Unknown 25%. And genetic is 25%. So trisomy 21, the Down syndrome, is the single most frequent cause of intellectual disability. Down syndrome, आप सब पहचान जाते हैं because of the specific features the child presents to you, right? So psychiatric comorbidity is very high. All of these individuals, from mild to severe, they have psychiatric morbidity, anxiety, oppositional defiance disorder, autism, ADHD, depression, conduct problems. Diagnosis of psychiatric disorders is difficult, but it is very much prevalent. And specific syndromes often associated with symptom cluster, for example, Fragile X with ADHD. अब मैं उस दिन Mahanur, I don't know she is here or not. She was asking me कि जी ADHD का diagnosis. मैं ADHD का diagnosis के बारे में simple सी ये बात करूं कि हम स्किज़ोफ्रेनिया के डायग्नोसिस के लिए स्केल्स इस्तेमाल करते हैं? हम नहीं करते। हम डिप्रेशन के डायग्नोसिस के लिए कोई स्केल इस्तेमाल करते हैं? हम क्लिनिकली नहीं करते। हम क्लिनिक में बैठ के जब हम बच्चे को देखते हैं, एडल्ट्स को देखते हैं, हम स्किज़ोफ्रेनिया का डायग्नोसिस हम स्ट्रेट अवे बना देते हैं कि जी इसको हेलुसिनेशंस हैं, डिल्यूजन्स हैं, पैरानोया है, ये स्किज़ोफ्रेनिया है। This is having weeping, crying spells and blah, blah, blah symptoms. So this is major depressive disorder. Why we cannot make the diagnosis of ADHD without giving the scales to the family? Why? This is unfortunately a critical situation. We see the symptoms, we see the behavior problems, we don't make the diagnosis because we feel that इसके लिए scales apply करने जरूरी हैं. No, it's a clinical diagnosis. Just like schizophrenia, just like major depressive disorder, you can, on your clinical assessment, make the diagnosis of ADHD. However, in those situations as well, the best is to do the psychometry. And in this situation as well, the best is that you should do the psychometric assessment. But if you don't have the scales, if you don't have the readily available situation where you can, especially in Pakistan situation, if you don't have access to those facilities, then you cannot make the diagnosis of ADHD. I don't agree with that idea. You can still make the diagnosis of ADHD. Fragile X syndrome, yes, you can still make the diagnosis of Fragile X syndrome. Medical comorbidity also common. So epilepsy, cerebral palsy, sensory issues, most common. CP के मरीज, मैंने पाकिस्तान में CP के मरीज कोई भी 20-25 साल से ज्यादा उम्र का नहीं देखा. यहाँ पे CP के मरीज, मेरी 3 पेशेंट CP के 55 प्लस हैं, राइट? They are on wheelchairs, they have motors on it. सुबह टीम जाती है, उनको बिस्तर से उठाती है, नहलाती धुलाती है, कपड़े पहनाती है, चेयर में बिठाती है, सारा दिन वो पूरे शहर में घूमते फिरते हैं, इंडिपेंडेंट लाइफ गुजारते हैं और शाम को वापस घर पहुंचते हैं और फिर उनको टीम आती है, शाम को वो उठाती है, क्रेन के जरिए उनको बेड पे लटाती है, साफ सुथ करती है, खाना पीना देती है, टीवी रिमोट सब कुछ देती है. सो दे लिव इंडिपेंडेंटली. दैट इज अनफॉर्चुनेटली द डिफरेंस बिटवीन अ डेवलप्ड एंड अ low middle income country. But this never means that we cannot provide these facilities to the individuals in Pakistan. So please, unless or until you will know this, you will probably miss this. And unless or until we won't be able to educate the families, we won't be able to do anything about it. More psychiatrists in Pakistan, more awareness in Pakistan, more people in Pakistan, better is the outcome of psychiatric mobility. This was my target right from the day one, to educate people and make more psychiatrists. हम जितने ज्यादा होंगे उतना हमारी आवाज सुनी जाएगी और जितनी हमारी आवाज सुनी जाएगी उतना अवेयरनेस क्रिएट होगी और ये प्रॉब्लम्स एड्रेस हो जाएंगी. Down syndrome, trisomy 21, 1 in 1000. Fragile X, 1 in 2000. Phenylketonuria, variable prevalence, 1 in 4000. Congenital hypothyroidism, 1 in 2000. Fetal alcohol syndrome, 0.2 to 1.5 in 1000. What cause of ID are common in your country? I don't know, because there is no research. So I cannot say what is common. But still, I know that all of these are present, but we don't see them because we don't. So now, coming to the clinical features, the Down syndrome. मैंने कहा Down syndrome ऐसा है जो हर एक को नजर आ जाता है, पता भी चल जाता है. So the growth failure, mental retardation, flat back of head, abnormal ears, many loops on the fingertips, palm creases are significant, special skin ridge patterns are there, unilateral or bilateral absence of one rib, intestinal blockage, umbilical hernia, abnormal pelvis, broad flat face, stenting eyes, epicanthic eye fold, share one nose, something about the nose. Then short and broad hands, small and arched palate, big wrinkled tongue, dental abnormalities, congenital heart disorders, enlarged colon, and big toes widely spread. So the Down syndrome patients, as soon as He enters into your room, you feel, okay, this is Down syndrome. Everybody knows about it. All medical students knows about it. But what about this one? Are we able to assess Fragile X, which is again very common? And unfortunately, Fragile X, they have developmental disability, they have attention problems, they have anxiety, hyperactivity, autism, and depression. So they present to you with depressive symptoms, maybe at the age of 14, maybe at the age of 17, maybe at the age of 20. But are you able to see the clinical features of Fragile X in the person and say that this person is suffering from Fragile X syndrome? Probably I will miss it. So here what I do is that if I have a doubt, I just give them a blood test. They go for a blood test and the report comes positive. This is Fragile X and I'm okay with it. In Pakistan, I don't have the liberty of it. So I have to rely on the clinical features. Prominent characteristics of Fragile X syndromes include an elongated face, lambe मुंह वाले, large and protruding ears, कान ऐसे बाहर की तरफ निकले होते हैं बड़े बड़े, and low muscle tone, ढीले ढाले, जहां बैठे ऐसे करके बैठे, right? We never look at them. We feel that this is just a normal variation of a normal individual, which is not. We miss it clinically, and then things are complicated. So phenylketonuria, again, never-ending story. There are so many things into it. Iodine deficiency causes hypothyroidism. शुगर है पाकिस्तान में hypothyroidism डायग्नोज जल्दी हो जाता है. हम T3, T4, TSH करवाते हैं और हमें पता चल जाता है कि ये क्या है और फिर गोइटर के केसेस हमें नजर आ जाते हैं, हम उनको ट्रीट कर देते हैं. So that is fortunately very well covered now in Pakistan. So I won't go into that detail. Condition associated with intellectual disability, Prader-Willi syndrome. This syndrome, I was not familiar of it. Now I have at least 7 of patients who are having Prader-Willi syndrome here in Canada, which is surprising because in Pakistan, I never thought anybody would be suffering from Prader-Willi because I never heard of it, because I never read about it, despite the fact that I was practicing psychiatry, which is unfortunate, which is very, very unfortunate. Jessica Dickinson, Justice Faith's story, Hannah's story. So these are some of the people across the globe which are prominent with this syndrome. Surprisingly, the clinical features are very significant. I don't know if I haven't written the clinical features of Prader-Willi. Just go back, look at that. Prader-Willi syndrome, there are very specific features. These people have coporophagia. They eat their feces. They have bulky. They eat a lot. They have broad pelvis. They have psychiatric morbidity. They have behavioral problems. Sometimes they are missed as a diagnosis of schizophrenia, but they are not actually schizophrenia. It's a Prader-Willi syndrome that needs to be addressed properly. Similarly, Angelman syndrome, common. Again, can you differentiate this child's photograph with any normal child? Probably you will say that this is normal, but this is actually not normal. There are features which are indicative of Angelman syndrome. And if you don't know, you will miss it. Galactosemia, again, we don't see it. It causes brain damage, cataracts, jaundice, enlarged liver, kidney damage. If a galactosemic infant is given milk, unmetabolized milk and sugars build up and damage the liver, eyes, and kidneys and brain, and consequences is death. Galactosemic children do have brain damage, but it happens only if it is not diagnosed properly. Maybe our pediatricians are better equipped to diagnose it, but I haven't seen any in my clinical practice anybody diagnosed as galactosemia and on a diet which lacks certain things which cannot worsen their intellectual disability. I haven't seen. यहाँ पे बड़ा commonly मिलती हैं gluten free diet, और हमने पाकिस्तान में कभी gluten free diet के बारे में सोचा नहीं. So unfortunately, again, living in a low middle income country and developed country, these are the problems. Fetal alcohol syndrome. This is again the mothers who uses alcohol during pregnancy give birth to children who have fetal alcohol syndrome, It's very common here. Of course, this is one thing that I can say that is not very common in Pakistan, but even here it's not very common. So IQ is below 70, impairment of adaptive functioning, onset before age of 18, family medical history, pregnancy, development, impairment, home can be lead to some consequences. Physical examination, IQ measurement, adaptive behavior, clinical judgment and scales, labs and genetic testing confirms it. Cross-cultural differences. How would you diagnose ID in a country without a validated IQ test? This is unfortunate. This is very unfortunate. वेस का जो वर्जन रिसेंट चल रहा है वो पाकिस्तान में ट्रांसलेटेड और वैलिडेटेड नहीं है, इसलिए कि वो इटसेल्फ यहाँ पे बहुत महंगा है, और हम अगर खरीद के उसको पाकिस्तान में लेके जाते हैं और हम उसको ट्रांसलेट और वैलिडेट करना चाहते हैं तो उसके लिए हमें स्पेशल परमिशंस चाहिए, और वो स्पेशल परमिशंस लेने के लिए हमें बहुत सारा काम करना पड़ेगा, और अनफॉर्चुनेटली कोई भी ये काम करने को तैयार नहीं है. सो हम अभी भी अंग्रेजी वाले कुछ इंस्ट्रूमेंट्स कुछ जगहों पर पाकिस्तान में इस्तेमाल करते हैं, which is unfortunate. So we make a rough estimate of IQ, right? Rough estimate. So कैसे करते हैं? A child is 6 years old. She is toilet trained and can eat by herself. She still needs help dressing, but can put on a t-shirt. She can walk and jump, but only balance for 1 to 2 seconds on each foot. Her speech is understandable and she can name some colors but cannot count. She can scribble and copy a straight line but not a circle. Her teacher says she is not yet ready for first grade. How do you estimate her developmental age? How do you estimate her IQ? ये clinical questions हैं. So assessing IQ. WISC is the most common scale that can be used. Denver 2 or similar scales can be used. Ask about academic functioning in older children. Mild ID may be able to reach grade 2 to 6. Moderate ID may be able to speak, understand, learn. Severe ID can have some speech problem. Ask parents about their estimate of developmental age. So, in Pakistan, when we see a child who is, say, 11 years of age or 7 years of age and having this kind of problems, what do? Ideally speaking, we should go for psychometric assessment, but usually we don't. So अगर हमें वो facilities नहीं है तो फिर हम क्या करेंगे? हम ये करेंगे कि हमें understanding होनी चाहिए कि किस उम्र में बच्चा कौन कौन से काम कर सकता है, और अगर हम उसकी डिटेल्ड पैरामीटर्स को असेस कर लेंगे कि इस उम्र के बच्चे को ये सारे काम कर लेने चाहिए, और अगर बच्चे उसको फुलफिल नहीं कर रहे तो एटलीस्ट हमारे पास एक रफ गाइड आ जाएगी. सो कहने का मतलब ये कि अगर आप चाइल्ड साइकियाट्री में काम करते हैं और आपके पास स्कोरिंग शीट्स अवेलेबल नहीं है और IQ टेस्टिंग्स अवेलेबल नहीं है तो फिर आप पढ़ें और हर उम्र के बच्चे की डेवलपमेंटल जो पैरामीटर्स हैं उनको याद करें और उनको क्लिनिकली अप्लाई करें ताकि ऐसे बच्चों को हम प्रॉपरली हेल्प आउट कर सकें. लाइक heel prick test, routinely done by voluntary to detect the genetic disorders in an infant 48 to 72 hours old. It usually screens newborns for phenylketonuria, primary congenital hypothyroidism and cystic fibrosis. एक पिन प्रिक हील पे करने से ये 3 डायग्नोसिस असेस हो सकते हैं. So we have to know how we can cope with these things. Medical differential diagnosis excludes sensory deafness, poor insight problem. Take good care to identify underlying causes of ID, especially those reversible. Infections हैं, neurological disorders है, epilepsy है, endocrinal problems, ये सारे reversible causes हैं of mental retardation. And reversible causes of mental retardation should be assessed properly so that we can intervene in time and help them properly. Any sudden regression, loss of skills that were once mastered should be treated. पहले तो ये बैठ जाता था, अब बैठना छोड़ दिया. पहले तो इसकी गर्दन टिक गई थी, अब गर्दन टिकना खत्म हो गई है. पहले तो ये बोलना शुरू हो गया था, अब वो अल्फाज पूरी तरह नहीं बोल पा रहा. So you should assess them. an assessment, clinical assessment, and only then we can do something about it. Psychiatric diagnosis is important. Most importantly, these children are unfortunate victims of abuse, child abuse, sexual abuse, and other abuse, neglect, and specific problems related to it. So we should be careful in handling them. Further considerations, always check how parents are coping. Depression in mothers is common. Marital discord, माँ बाप के झगड़े, मार कुटाइयाँ, लड़ाइयाँ, खिचखिचें बहुत सारी problems generate कर देती हैं. Child abuse or neglect, severe bullying, exclusion, severe deprivation, and poverty. Unfortunately, the poverty is a factor as well. So maternal depression, poor stimulating environment should be assessed. Again, I won't go into the details. Aims of the treatment is to make sure that the child won't go into further deterioration. So if there is a treatable cause, we should treat it. If there is a correctable cause, it should be corrected in time. Psychiatry में हम लफ्ज यूज करते हैं ना, earlier the diagnosis, the better the prognosis. This is what it is. Earlier the diagnosis, better is the prognosis, because then you take more years to correct the things. If you won't look, things will be complicated. Most of these people will die away. Evidence-based treatments. Ideally speaking, again, जैसे hypothyroidism में आप thyroxine की गोली दे देते हैं, फेनाइलकीटोन्यूरिया में आप ट्रीटमेंट कर देते हैं, पेरेंट्स को आप टीच कर देते हैं, एजुकेट कर देते हैं, स्पीच थेरेपिस्ट पाकिस्तान में अवेलेबल हैं, वो दे देते हैं, एजुकेशनल प्लानिंग आप अवेलेबल करा देते हैं. सो देयर आर थिंग्स दैट यू कैन डू इवन इन पाकिस्तान, despite the fact that there are limitations. So make sure that you assess them earlier. Family education, explain problems to the parents. क्यों हो रहा है, किस तरह होगा, कैसे ठीक होगा, कितने अरसे के लिए दवाई देनी है. और एग्जाम में this question is asked quite frequently. You have to provide education to psychoeducation to parents of child suffering from mental subnormality, this or intellectual disability. This question is very common in the station, so make sure that you learn this and know this. Hearing and vision problems are very common. They should be addressed. Nutrition is common. They should be addressed. Managing co-occurring epilepsy, depression, and behavioral problems. हम हर एक behavioral problem को antipsychotic drugs दे देते हैं. Again, ज़रूरी नहीं है. Assess them properly. So maybe they need just the counseling. Maybe just need an anti-anxiety. Maybe they just need treatment from epilepsy. Most of the time we miss the diagnosis of epilepsy as well in these individuals, and things do get complicated because it leads to brain damage, so which is a problem. So make sure that you assess them properly, teach, train, and recommend. I will definitely send you these slides so you can look at them and you can treat. As I told you earlier, that we have to make sure that if we see something, we have to treat it. ADHD, अगर हमें नजर आ जाता है तो हमें उसके लिए इलाज करना है, राइट? और अगर हम नहीं करेंगे तो हम मिस कर जाएंगे, राइट? थैंक यू वेरी मच फॉर लिसनिंग टू मी. एनी क्वेश्चन? ओके, सो इट वाज जस्ट 40 minutes, which is fine. हाँ जी, सब समझ आ गया या कुछ समझ नहीं आया? So any question? Nope.